Hi, this is Lily Cotilla. Welcome to IboGreen. IboGreen is an Ibogaine clinic located in Playas, Tijuana. Ibogaine is a plant medicine that originated in Africa and is cultivated and utilized by the Opiate tribe. Like many medicines from the rainforest, including the yew tree, which first produced Taxol, a helpful agent for cancer. There are many medicinal values of plant medicines in the rainforest that ultimately the pharmacological companies will extrapolate and put into medicine form. Now that said, who knows how really energetically things change once run through the laboratory process? I mean, is it like fresh meat in comparison to, I don't know, packaged bologna? It's an interesting thing to think about, this live plant medicine and the effects without it being tampered and filled with agents and or put through chemical processes in terms of the efficacy on the human body. I believe the US is attempting to design something called M18, or it's some initial and number similar to that has similar properties to Ibogaine in order to combat opiate addiction withdrawals. However, hands down, Ibogaine across the world is recognized as the primary solution and way to eliminate heroin and opiate withdrawals such that an individual can return to normal functioning life. There are basically three forms of Ibogaine. There's TA, or total alkaloid. There's HCl, which is hydrochloric, and there is also root bark. People go about it in different ways. Sometimes people choose to use much root bark over the course of time. Sometimes people choose to use smaller amounts of the HCl variety. And for psycho-spiritual purposes primarily, people are interested in using total alkaloid because it produces more of a psychedelic aspect than the HCl. Though in the HCl form of Ibogaine, 70% of clients will have psychedelic components. And in my personal experience with practicing psychology with clients, the percentage is actually way higher than that. And the psychedelic component is important, I believe, in the recovery process. But for now, I'll just talk about how it affects the somatic cells and the withdrawal process. So Ibogaine HCl is given to a client who is coming off opiates in order to prevent withdrawals. It is measured according to kilograms of body weight, such that you get the appropriate dosage. Your liver enzymes are checked via blood work to make sure that your liver can properly process the plant medicine, and you're also given an EKG to make sure your cardiac functioning is in optimal condition and can manage the heavy-duty effects of this plant medicine, Ibogaine. But let's face it, guys, heroin and opiates have heavy-duty effects on the body. So what normally happens is an Ibogaine flood dose of HCl is given to a patient coming off of opiates or heroin. Morphine is used as a temporary replacement from opiates and heroin to prevent the individual from going into withdrawals. The day of an Ibogaine treatment, the last morphine dose is approximately 12 hours before the administration of Ibogaine, such that right as withdrawals are about to set in, the Ibogaine goes into the system. The reason for this is that if you can imagine many little teacups representing the receptor sites of your cells, and they are filled with heroin or opiates or morphine to keep you from going into withdrawals, which is basically very similar to, it's a short-acting opiate. So if your little teacup cell receptor sites are filled with these opiates, there is no room for Ibogaine to enter the little teacup receptor cells of the body. Therefore, after 12 hours, when those teacups are emptied, or the morphine, the opiates have been eliminated from the body, there is a maximum amount of space in the cells of your body to hold the Ibogaine. And the Ibogaine filling up the receptor cell sites of the body is what prevents the withdrawals, which are really gnarly. It works because it almost tricks the body into thinking that it still has opiates in it, since the chemical composition is so similar. It's just that it is not addicting. It's a one-time process. Some research is showing that doing it 3 to 4 times the first year, every 3 months, can be beneficial for those who do struggle. Because Ibogaine is also stored as noribogaine within your adipocytes or fat cells, and it is released slowly over time. It also increases testosterone. At approximately the 10-week mark, the Ibogaine has been eliminated from your fat cells and you have no more stores left within. It is at this point in time that some people struggle a little bit again with the concept or idea that enters the mind and body of addiction. If you're one of these people, it's good to dip back in and get another flood dose of Ibogaine, though it will not be as intense as your original one since you're not coming off opiates. It's just like filling those teacup receptor cell sites again. But so Ibogaine, this plant medicine from Africa, prevents opiate withdrawals. 5,500 people become addicted to opiates every single day. There are over 13 million opiate addicts worldwide. AA and the 12-step process, along with all recovery-related programs based off of the 12 steps, have only a 5 to 10% recovery rate. In Brazil, 2016, the country legalized government research standardized protocol to implement Ibogaine in order to help opiates recover. And Bruno Chavez, the primary well-known provider there, has over a 70% success rate for opiate addicts maintaining recovery at the 1-year mark. So the main reason why it's so hard to get off opiates is because the withdrawals are just devastating. Hallucinations, sweats, electrical legs, nausea, vomiting, headaches, spotty eyes, nightmares, inability to sleep, you name it. And this goes on for 2 weeks or longer for the short-acting opiates, and for as long as 35 weeks for long-acting opiates, which the U.S. prescribes in order to help people get off the short-acting opiates. It's really no different, guys. It just lasts longer. Suboxone, methadone, Subutex, and others. So if you or anyone you know struggles with opiate or heroin addiction and you want to get your life back on track, the best way to start is with administration of Ibogaine, coupled with pre-psychospiritual and post-psychospiritual therapy to help integrate the plant medicine process and to design a life of the future free of drugs. The psychedelic element that presents in Ibogaine is important for a drug addict because it's almost as if The whole deck of cards in the mind has been reshuffled. The order in which you were once familiar, the ways in which you made sense of the world, the ways in which your ego and your emotions were attached to the facts that you thought to believe were true, are all reshuffled. Your purpose, your relations with people, your understanding of life changes. Your fears get addressed. Your open-ended regrets and or possibilities of life movement in the future are all presented during the psychedelic aspects of Ibogaine, including the visiting of many eras of time. It transcends the here and the now, and yet you are still in the here and now in body form. But it allows for aerial travel, if you will, and a bringing back and acquiescing of knowledge that is beyond the conditioning of our culture. Because the conditioning of our culture is what keeps many people stuck using opiates to numb out. So, keep Ibogaine and IboGreen, get clean with IboGreen in mind if you want to change the direction of your life.